Are you one of the tens of thousands of people suffering with a motor neuron disease? Do you suffer with symptoms of weakening of your limbs, of the inability to hold a fork or hold a glass or raise your arm or stand up out of the chair on your own? Have you tried various medications which don't seem to provide you relief for your condition, to strengthen your tissues, to get you back to normal function? Maybe you've even gone through various surgeries for other kinds of conditions in your life, like a carpal tunnel syndrome, as what may have been diagnosed at one time, or you've had some degenerative disc disease, and they said that the injury or the disc issues or arthritis in the spine has caused your weakness or pain in the arm and hand, or both arms and hands, or both legs and feet. So if you're one of the tens and tens of thousands of people suffering from a motor neuron condition, we need to really understand what is really going on with the body to finally help you remove the causes of your condition so you can regenerate your tissues and have any chance in regaining function to your body. My name is Dr. Lonnie Herman, and in this video I'm going to be sharing with you some very unique exam findings with a patient who came into my clinic back in May of 2017. The gentleman is, and I will not mention his name, there will be no private information given about this person, but he's 66 years of age and has suffered for many months with a neurodegenerative condition which has now been labeled by some doctors as a motor neuron disease. Whether or not they're going to call it Lou Gehrig's disease or ALS, that in the end it really doesn't matter what it's called, because we've really got to understand what would cause the tissue to break down and remove those hidden infections and toxins, and that's the reality. Hidden infections and toxins that are driving these neurodegenerative conditions. This gentleman, I'll get into some exam findings. He has not completed his first protocol yet, and I do look forward to seeing him in his next follow-up visit. But first of all, his condition, he had in his past a stent put into an artery by his heart. He has in his past had a defibrillator put into his chest. He has in his past had a inflammatory prostate condition going back over 20 years ago. He has in his past also had surgery on both hands for what was diagnosed at that time as carpal tunnel syndrome. The situation after his carpal tunnel syndrome procedure was, surgery was performed, is he said that his nerves went haywire. He lost muscle and he lost strength after he did the carpal tunnel surgery on both hands. His hands are swollen, his hands don't feel well, his hands feel weak. He's got poor balance, he's got twitching in both arms, he's got speech difficulties. And first, when I talk about speech, you can go and I'll put up the link to another video that I did put up on my YouTube channel about what's called dysarthria, or lack of ability to speak normal, or slurred speech, slurred speaking, almost like a drunk speech it sounds like. So I'm going to put that label up here on the screen of the that video that I did on dysarthria, as well as a link below this video so that you can go click on that and watch that, that video about dysarthria. He also complained, or I should say informed me, that he had 2 years of steroid shots for the carpal tunnel problem. He had trigger finger shots. He had, this was done in 2016 and 17. He's had nerve testing done that the doctors have said all of his nerves are a problem. And heart palpitations, and there's a number of symptoms going on with this gentleman. So let's get into, and hopefully I didn't leave anything out right here about his initial symptoms. That's pretty much it. So let's get into what the findings are. And I'm going to show you some images here. On the side right here, I'll put up some pictures here that I took of the inside of this gentleman's mouth, because I do realize, and I'll put up an article as well, the title that you can read, of how infections in the gums, infections in the teeth, infections in your jawbone, and even substances like heavy metals like mercury, what you call silver, some people call silver fillings, or dental amalgams. These fillings and other metal crowns, which I'll show you an image of those other teeth in his mouth, that the metals and the infections, even hidden infections in the gums and the teeth, which will not show up on a dental x-ray, because dental x-rays will only find an infection when it's 75% advanced. So there is a better technology to use called a CAT scan. After I do my unique dental examination on this patient, after I did the unique dental examination on this patient, I did send him out to a dentist who did confirm my findings about several areas in the mouth where he does have some old infections that have never been handled. The gentleman does have a fear of dentists. He's not comfortable with going to a dentist, but the reality is that when there's infection in the mouth that's breeding in the mouth, these infections can and will harden the arteries. They can actually get into the spinal cord, get into the brain through the various blood vessels from the mouth into the brain. I'll show you pictures of that and help you really grasp it, and cause the tissues to degenerate. And it's very simple. If you can understand that if you've ever in your life had an infection, let's just say, for example, like a strep throat, and when the infection, the streptococcus bacteria, is in the back of your throat, it could make your tongue swollen, it does make your throat swollen, or the immune reaction against these infections will swell up, cause inflammation in the throat. It's difficult to swallow. You lose the ability to function normally, swallowing normally. Maybe even speech is difficult because it's so swollen in the throat, maybe very red and the mouth red. So if you can lose your ability to swallow normally because of an infection that's in your throat, could you possibly lose your ability to function, raising your limbs and grab things and hold a glass or hold a fork, or dress yourself, or stand and walk, or get up out of a chair? Could you lose those functions as well because the infections can and will get into the motor neurons, into the spinal cord, into the brain, into your muscles, on your nerves, in your blood vessels, in your bone marrow, and these infections in these various tissues can and will cause you to lose normal function, and that's the reality. So first, what I want to do before I get into all the exam findings, I'm going to show you some images of what I found in his mouth, again confirmed with a CT scan. I'll even show you a picture of a CT scan on my left side here, which will give you hopefully provide you a greater ability to realize that infection can take up a big area in the jaw, and you will not have pain. You may not have any discomfort in the jaw. So even when the infection is there and it's going through blood vessels that go right into the brain or the brainstem or the spinal cord, you can lose function and disease the motor neurons. So first, let's get into a look at this picture here of his jaw. This is a great photo. So what you're going to see right here is I've got some areas pointed out with different colored arrows. So first, let's look at the area that shows the green arrow. You know, that green arrow, you can notice behind that tooth, there's an empty space. It looks like a very dark hole, a dark space there. What that actually is an infection where a tooth had come out of his mouth, and the infection remains in the jaw. The gum is infected, the jawbone is infected. That's known as a cavitation, which I will show you in a CT scan in just a moment. The infection is there, and it's being reproduced, or it is reproducing itself inside his mouth constantly, day and night, 24/7, 365. That infection he's swallowing it, which is going through his body, through his digestive system, into the bloodstream, into the muscles, into the brain. You are what you eat, you are what you drink. So when you are swallowing infections from the mouth that just go into the body through that means, then you're infecting your brain and body. And this is what's happening with this gentleman for many years. Further, you have blood vessels that are in your gums, you have blood vessels that are in the jawbone, which I'll show you in another image in a little bit, and those infections can travel through the blood vessels and go wherever they want to crawl to. You notice here there's another image, there's another arrow that's a black arrow on this picture. What I'm pointing out there, you can see very clearly there's a gap between where the gums are supposed to be located against the tooth and where they actually are now. So this is known as, and I'll show you in another picture in a minute, these are receding gums. When we have receding, the receding gums don't happen overnight in a person. There could be decades these receding gums had been receding, or the gums had been receding. When you have a tissue in your body that is receding, any other tissue in your body, not just the gums, can be receding. Receding gums are diseased gums. There are hidden infections in this man's gums. With my unique type of bioresonance testing, let me be clear, Because if you look up the term bioresonance to get a better, try to get a better grasp on what I'm doing, and I'm not going to get into great detail of my exact strategy and my method to do this, but I'm going to tell you that when you look up bioresonance, the bioresonance testing equipment run by computers that they connect you to and try to find what's in the body, I believe that it's not a very effective method at figuring out your condition. And this is all hands-on, very intense, hands-on manual stress reflex type of bioresonance analysis that I'm performing. And I have different samples of the gums and the glands in the cheek and the under the tongue and the motor neuron and the brain and the spinal cord and your arteries and your veins and your capillaries and your bone marrow and your stem cells and various other parts of the body, just about every other part of the body. I've got samples of these that I can actually analyze your tissues and find out what's in them, because I also have, in my clinic here, I have samples over 40 different individual bacteria. I have over 30 different parasitic infections. I have over all these different viruses, all different viruses. I have all different vaccine chemicals, 11 different mercury compounds, all the heavy metals from the periodic table chart, chemistry chart. I have all different anesthesia chemicals and different antibiotic residues and insecticides and pesticides and preservatives and molds and fungi and candidas and over-the-counter medications, any kind of toxin, lots of them, not any one, but many different infections and toxins that can get into your body. I've got samples of these that I can find with a very unique testing analysis and provide remedies that will help clear up these infections from your tissues and provide remedies to even strengthen the motor neuron, to strengthen the tissues that have been diseased for so long and help you start to recover yourself. So again, back to the receding gums here in the picture with the black arrow. Again, the black arrow that's in this image next to me. The receding gums are diseased gums, and those infections that are in those gums causing the recession of the gum is also causing recession, so to speak, disease, weakening, atrophy of your tissues elsewhere in the body. They can disease your stem cells that produce your blood. They can disease and atrophy the motor neurons. We've got to be able to get rid of these infections in the jaw. This is not the only topic here I'm going to discuss. I'll get more into it a bit later, but understand receding gums is not because you brushed wrong with a toothbrush. It's because infections are there that are diseasing the gums and causing them to recede. Notice in the other arrow there, that's a red arrow on the same tooth above the black arrow. You can see the discoloration on that tooth. That tooth, you notice there that it's got a grayish tint to it. There's mercury in that tooth and infection in that tooth that I found. And the infection I found in there is called treponema bacteria, a destructive bacteria. Also, if you look at the other arrow on the top left side of the picture here, it's a yellow arrow, and you'll notice there, and I'm going to show you some close-up images to the other side of his jaw in just a minute, but you notice that dark discoloration of that tooth with that yellow arrow. There is infection in that tooth and heavy metal in that tooth, mercury compound that's causing the neurological disease in this individual, and I'll make it even clearer in just a minute when you can actually see what's going on when you hear what I found going on inside of his tissues. The next picture I'm showing you here, you'll see there's two arrows. There's a yellow arrow and there's a blue arrow. And you also see my tongue depressor inside his jaw, which is right next to to his molar there. So first of all, the gold tooth, I'm going to switch over the screen right now. Looking at that gold tooth, let me switch to another picture and show you what I found in another patient who had a gold crown for over 30 years in her mouth. We'll come back to this picture in just a minute. And in this other patient who came to me with a serious skin condition as well as breast cancer, she had already had all the mercury fillings. Here's the picture inside of her mouth. She already had the mercury fillings, so she thought, taken out by a dentist who was a supposed high quality biological dentist who does the mercury removal in the safe measures, which is important. But when I did my first exam on her, I found as well, doing my unique dental exam, I found that she had this gold crown in her mouth. The dentist said nothing was wrong with the gold crown until I made it mandatory she goes back to that dentist. And here's what we found underneath. You see this picture here. This is when the gold crown came off of the tooth. And underneath, look at all these yellow arrows I've got pointing out here with this tooth. There was infection, a moldy bacterial crud, I don't know a better word to use, disgusting infection living and breeding underneath that crown for however long in the past 30-year period that she had this crown in her mouth. And these infections she swallowed. These infections just went through the bloodstream and were causing serious skin conditions. I'll put a link underneath this video. You'll see the skin recovery in this patient. Dramatic, going from a horrible disease condition in her legs to zero. The skin cleared up 100%. I'll put that link underneath. Let me show you another picture of the other angle of underneath that tooth. And here you see from the other side, you can see all the black, moldy, cruddy bacterial infection that was underneath there. Then the dentist, when he cleaned all that away, he also cleaned off this gold-looking film that was on the tooth underneath the crown. And we found underneath that crown a big metal filling. And here is the picture. You see this right next to the dental utensil. Look at that image. That big mercury filling, so-called silver filling dental amalgam, poison mercury inside that tooth for 30 years underneath the crown, and the dentist could not see through the crown on the dental x-ray or with his great skill. And so getting back to this gentleman here, to look at that gold crown in his mouth with that yellow arrow, that gold crown is hiding some infection and some toxin underneath. You look at the other tooth with the blue arrow right next to that yellow arrowed, next to that gold tooth, you can see the tooth, it appears like it's actually been like cut in half, as well as the white filling in there. But also notice around that white filling that there's a very dark discoloration in there, and I found more bacteria, including streptococcus infection in that tooth. With my very unique system, my very unique dental examination, I was able to match up which infections were in that tooth. He has not taken care of the dental part yet. Seriously important in order for him to start to really make a very proactive step towards helping himself reverse this disease. We've got to get rid of these infections in the mouth. Let me point out another angle inside of his mouth here. And this picture right here is the top on the right side. You can see these other two teeth where he's got one tooth in the back that's touching that tongue depressor. He's got a metal filling, silver, so-called silver, mercury filling, poisonous to the body. He's got where the tongue, right next to that tooth, in between those two metal filling teeth, he's got another crown, and underneath that crown, I found more streptococcus bacteria and more metal underneath that crown. And let's understand even further about the importance of dealing with this, getting rid of these infections. Before I get to that, let me point out this other angle that I took on the side. Remember when I pointed out before, and a few pictures ago, I showed that he had the gold crown down there in the lower jaw. Well, look at this picture of this tooth that's adjacent to the gold crown on the other side of that gold crown than what I showed you before. You could see the dark discoloration where the tooth is supposed to meet the gums. The gums have receded so low that it's almost showing the root of the tooth. Infection has been breeding in this man's mouth for decades, causing the destruction of the gums, and those infections he swallowed without knowing it. He swallowed these infections. These infections are going through the blood vessels that can get into the brain and the spine. Let's look at another picture here showing the jawbone. And if you look in this photo, real simple, you'll notice that in each tooth there's arteries. These red vessels in this drawing are arteries that are in the face, go into the carotid artery. See, I have it labeled there with the yellow letters with a black outline. It says the carotid artery, the vertical there, behind the jawbone. Notice that each tooth has blood vessels. Those are arteries. Every tooth has capillaries and veins and a nerve in every single tooth. So the infection living inside the gums, infection living inside the tooth, infection living inside the jawbone, which I'll show you the cavitation of the CT scan in just a minute. Not of him, but another patient. But these infections can easily, for years, without even knowing it's going on, without a symptom, until, oh, I have inflamed prostate, inflamed joints, my body's not working well, I've got a heart condition. Because again, and this other journal I'll put up now, before I even explain a bit more about this Journal of Mucosal Immunology, and I'll put the article up here, or at least the reference, the link to that article or title of it, that they found that synovial fluid inflammation, joints where rheumatoid arthritis existed in patients, they found the same infection in the joint that they found in the gums when they took biopsies of the gums. They found that these infections can totally cause inflammatory processes in the joints, as well as what they stated, and maybe I'll even put the sentence or two from a paragraph in the study, that they found that these infections from the gums in the study, they were lining the arteries, causing arteriosclerosis, hardening of the arteries. How can that be good for the heart? How can that be good for the brain? How can that be good for the spinal cord? So when the infections are traveling from the teeth through the blood vessels, up the carotid artery into the brain, down through the aorta, which I'll show you in a picture in a minute, this main blood vessel aorta, it can go into the heart and infect the heart and cause heart disease. It can go to your kidney, your spinal cord, your motor neurons, your legs, your anywhere. Blood vessels go everywhere in the body. Let's see even clearer where the carotid artery gets attached to. This picture shows your aorta, and the aorta, which I have pointed out with red arrows here, the aorta is a blood vessel, and you see going down the whole spine. This is a side view of the spine with the aorta. That aorta has blood vessels. You'll notice that there are arteries, branches of blood vessels that go from the aorta into the spinal cord. So infection from the tooth can travel through a blood vessel. It can go down through the carotid artery to the aorta and travel right into the spinal cord and disease your motor neurons in the brainstem, in the spinal cord, anywhere. Let's show you another close-up. Here's a picture of where the aorta, look at this picture on my side. I've got a picture. This is the aorta. You'll see it. It says aorta pointing out that big red tube there in the front. Then you've got the vertebrae, the bone of the spine, and right behind it, another yellow arrow, or black and yellow arrow I have pointed out, the arteries that go into the spinal cord. So infection from the tooth can go right through, down the carotid artery, go into the aorta, go into the spinal cord, into the vertebrae. I'll show you this even closer up. Here's another image. The spinal cord. Look how deep inside the spinal cord, where in addition to lots of other body functions, you have motor neurons existing. Look how deep inside you have a network of these arteries that are branching off the aorta that go into the spinal cord tissue where the motor neurons exist. Further, I'm going to show you another picture. This is what it looks like with veins going into the spinal cord. These blue vessels, you've got veins that also can carry infections. These infections can crawl up these blood vessels just like ants crawling from an ant pile to a piece of pizza on the sidewalk. And if you've got pizza and food all around that ant pile, they're going to crawl in any direction to get the food from everywhere. So let's understand this, that these veins are going inside. You see them going inside the vertebrae. You see them going inside the spinal cord and diseasing the tissues from the jaw. Let me show you this other picture here. Here's a great image of blood vessels, both arteries and veins. You see blue, they look like blue tubes and red tubes that go right up into the brain, diseasing the brain. So infection from the jaw can travel right up into the brain, disease the brain. We have upper motor neurons in our cortex of our brain. We have other motor neurons in the brainstem and lower motor neurons that go down the spinal cord. So any of these tissues can be infected from the jaw. Again, not only from the jaw, and I'll elaborate on that in just a moment. Here's an image of a CT scan. And what I did was, this is from a different patient, but what I did in this image of the CT scan, I've got all these green arrows, and you'll see it says like a number 2 there, and it says a number 3 with a red arrow. And around that, I drew around it in a circle because there's a circular dark pattern of infection inside. This was underneath a root canal, a bridge with a root canal in this woman's jaw. And I found infection that was in her jawbone. The infection was taking up a big part of the jaw where she has lost teeth in the past. And the teeth became loose and had to come out because the jawbone was infected years ago, and the dentist never did anything about the infection in the jawbone. Now, infections in the jawbone can come from the teeth, but they can also come from body parts. We have blood vessels in our organs. If your stomach was infected at some point in your life and still might be infected, maybe you have bloating, maybe you've had diarrhea, maybe you had food poisoning, the infections can travel up the blood vessels and go into the jaw and eat out the jawbone and eat out the tooth as well. Let me show you one other image. I just want to be even clearer about what can hide under crowns in your mouth and you have no idea because your dentist, who you trust, says everything is fine, everything is okay, there's nothing wrong with the tooth, you don't have any pain? No. There's no bleeding? No. There's no sensitivity? No. The crown has been there 20 years, it's fine, don't worry about it. Well, let's look at this tooth. This is from a patient. You'll see in the top corner, on the top part of this image, this was a patient from years ago. I found the tooth was connected to her inflammatory autoimmune thyroid disease, and she reluctantly went to a dentist who I sent her to because she trusted her dentist's reasoning that the tooth was fine. The dentist took off the crown, and look what we found underneath. So what you see in the top part of the picture is the crown is upside down. So you're looking at the metal shell that fits on the tooth, and it's got a porcelain, so it's the crown taken off the tooth and sitting like this underneath. And what you see in this picture is the tooth itself, the whole tooth was pulled because the disease of the tooth was horrible. She had no idea, no sensitivity, no symptom to that tooth, but it was diseasing her thyroid and other tissues. I'll show you a picture of the thyroid in a minute to help you understand more, but that tooth was diseased underneath that crown, and she had no sensation of the breeding of the infection, reproduction of infection, leading to disease in her body. Let me show you this real quick, and then we'll get into his other findings. But when we look at, let me go back for just a moment and point something out. This picture again shows the shows the jawbone with the blood vessels, and these blood vessels travel from a tooth and go right to the carotid artery. Well, let's look and see a branch in this picture. You'll see here, which I have an arrow pointing at the top side of this image. You'll see that there's an artery, which is called the superior thyroid artery, which I left the words on the screen there in this photo. Superior thyroid artery branches off the carotid, and it goes right to the thyroid and parathyroid gland in your neck. So an infection that's here, hidden, with no symptoms, can travel right down and disease your thyroid gland. It can go anywhere in the body. Anywhere in your body. Point well made. I hope so. So this gentleman, when I did my exam on him, my very unique exam on him to find what's causing his condition, to find what's causing it, and help provide specific remedies, safe, effective remedies to remove these causes so he can start to repair himself. For the first time in his life, to find this out and start to really take a proactive approach. Let me just tell you, again, going back, when I sent him out after I took notes on my unique dental exam and sent it over to the dentist to have them do a CT scan, confirmation there's cavitations, infections like the CT scan picture I showed you, infections in the jawbone and the root canals in his mouth. And let me put these words up here called dangers of root canals. Google search said if you have root canals in your mouth, you deserve to know. Look at the Weston Price Foundation. Look at the information that has been done about root canals and their link to chronic disease in the body. And there's a lot of other research about out there, but you can just at least simple. You got a root canal, been there for 5 years, 20, 30, 50 years, whatever. Look at the information, dangers of root canals. These root canals are not healthy. They're not good for keeping your body healthy. So I just want to be clear. He had metal in many teeth. You saw the pictures before, and he had a confirmation of infections inside the root canals and infection inside the jawbone with the CT scan. I found in the first part of his exam, or the first exam I did with him, he is inside the brain. We have a tissue called the hypothalamus. The hypothalamus, I'll put the word up here, hypothalamus. The hypothalamus controls or influences directly your heart rate. So heart palpitations can occur because the hypothalamus, not only, but there are other tissues. Heart palpitations can occur because of infection, inflammation, and toxins that get into the hypothalamus. Whether it's metal from a tooth, anesthesia from a surgery, insecticides, pesticides, preservatives can all get inside the hypothalamus and cause it to become diseased. He had different types of strep infection. He had a group B strep infection. He had strep pneumonia inside his hypothalamus. He had insecticides called malathion. Insecticides kill bugs. What do you think happens when you eat food that has insecticides on them? And you digest those insecticides, and you don't taste them. You have no idea they're there. But guess what those insecticides do to your body and your tissues? And no, it's not just okay to just take a probiotic and think you're fixing the insecticide damage, because the insecticide gets into the brain. The insecticide can get on your nerve. It can get into your spinal cord and cause disease of the tissue. He had malathion insecticide in his hypothalamus. He has these what's called herbicides in his herbicides in his hypothalamus. He had three different Candida infections, Candida krusei, Candida albicans, and Candida glabrata in his hypothalamus. I found the Borrelia burgdorferi bacteria, one of the main infections in what we call Lyme disease. I found that Borrelia inside his hypothalamus. Babesia microti, a very dangerous, damaging parasitic infection, damaging the hypothalamus. I found dental mercury inside his hypothalamus. And these are all not good findings. The remedies I'm providing him will remove those infections safely and help to repair the damage to the hypothalamus and boost up its function. the damage it suffered from the infections and toxins. I found in his stem cells, which make the blood to feed the brain and feed the motor neurons, I found Candida glabrata in his stem cells. I found in a part of the brain stem, which is known as the reticular formation. But let me go back a minute. Before I even get to the reticular formation, the hypothalamus is your nervous system, endocrine system chief. The hypothalamus produces and regulates all the hormones of your whole body, more hormones than what you're aware of, what you might be informed about. It's not just testosterone or estrogen or progesterone or cortisol or insulin. You've got regulation of many different hormones that help you to sleep, that help you to get hunger sensations, that help you to do so many different functions of your body that there's a lot of hormones that you're never getting tested when your doctor may run, or your endocrinologist or some other doctor runs a hormone test. There's a lot of other hormones in the body that regulate other systems of the body. So it's really important to understand the hypothalamus is critical for energy in the body. It is one of the main energy arousal, and I don't mean sexual arousal, I mean arousal. I wake up and I've got energy to go through my day. The hypothalamus is the chief, not the adrenal glands. The adrenal glands, when a doctor, if you've ever had done an adrenal test, a cortisol rhythm or circadian rhythm test, you can't, and I've done that before and I realized it didn't work, you cannot make changes to the adrenal cortisol rhythm, sustainable changes to the adrenal gland circadian cortisol rhythm by giving supplements or giving some kind of creams or something like that to support the adrenal gland when you find the adrenal gland is out of order in an adrenal circadian rhythm cortisol test. Saliva testing, you can't, because when you have the chief who tells the adrenal gland what to do, which tells, I should say, the hypothalamus, when the hypothalamus is sick and you don't fix that, when you don't clean it up, what's going to happen to the adrenal gland? It's always going to be out of order. When you have blood vessels going to the adrenal gland, carrying infection to the adrenal gland, you could try to aid the adrenal gland in different ways with diet, gluten-free, dairy-free, or soy-free, or you take supplements for the adrenal, or creams that you put on your body, or take drops for the adrenal. You've got to clean up where the stress to the adrenal gland is coming from to see adrenal gland really have normal function again. Just to be clear about that. Again, back to what I found in the brainstem called the reticular formation. The reticular formation does a lot for us. It helps us to produce serotonin. It helps us to sleep at night. It helps us to control digestive function. It has nerve centers inside, nuclei inside that control speech. It's just such an incredible complex of nerve tissue within our brain stem. I found in his reticular formation, and so much of the information from the feet and body parts to get to the brain, and from the brain to get to the body, it has to go through this reticular formation. So what would happen when the infections or toxins are in that reticular formation and diseasing it? Many of the functions of the body are not going to take place appropriately, A, and B, you're going to have a chronic inflammatory immune response that's causing more systemic inflammation everywhere because the body is fighting so many different infections in different tissues as well as inside its own brainstem tissue. The reticular formation, more strep infection, more candida infection, as well as mercury in there. I further found the motor neurons. I have samples of motor neurons that I'm able to study with a very unique test with patients. I found dental mercury diseasing his motor neurons. We're not going to do anything about that mercury in his motor neuron at this point because he still has all this metal in his mouth, and I'm afraid that if I was to do something, I'm concerned, I'm cautious, not afraid, but cautious, that if I do something to try to get the mercury out of the tissue while the metal is still in the mouth, we may disease him more. And that's not the goal. The goal is to help somebody help themselves, fix themselves. He's got scabies infection in his motor neurons. Scabies. You do not have to ever have a skin kind of irritation, scabies looking reaction on your skin, your arm, your head, your chest, your back, your leg, your anywhere. Scabies can live inside your body. Just imagine what it looks like. I'll put a picture up next to me on the screen here of what a scabies reaction looks like on the skin, scabies infection on the skin. Just imagine if you see this in the skin, imagine what that same infection would do when it's inside the spinal cord, in your cortex of your brain where you have upper motor neurons, inside your brain stem, to the other motor neurons in the body. What's going to happen to those tissues? Are they going to be inflamed? Are they going to work well? They're going to be inflamed. They're not going to work well. So he may have more infections in there and toxins in there that we just can't get to yet. The body only has strength to do so much in a certain protocol at a certain time. I found candida infection in his sinuses. I found the inside his what's called microglial cells, G-L-I-A-L. I'll put that name up next to me here. The glial cells are cells that repair nerves, part of your nervous system, repairs your nerves, and reproduces myelin, the myelin sheath that covers your nerves. You have myelin in all the white matter of your nervous system. You have white matter in your brain. You have white matter in your brainstem, spinal cord. You have nerves that carry signals from the brain, brainstem, spinal cord out to your body. When the nerve can't be repaired because of infection or toxin in those cells called glial cells, you're going to have a constant destruction that is, to the doctors, they're just going to medicate you. And for me, I'm looking at what's causing it. I've got extensive background in functional neurology, neurochemistry, immunology, endocrinology, cardiology, dental work, very big into dental work for the last few years of my life, to really understand what's causing these crippling conditions in individuals and help people find the hidden causes and remove them. So in his glial cells, he's got organochlorine pesticide chemicals. These organochlorine pesticide chemicals have been linked to leukemia, they've been linked to anemia, they've been linked to neurodegenerative conditions. I may put a couple of articles up here or titles, some things that you can look up your own and find it. Organopesticide chemicals inside his glial cells, damaging his glial cells. The remedy will get it out of there so that the body can start to recoup. Doesn't mean it's going to be overnight healing for this individual. There's a lot of cleanup that still needs to be done, again in the jawbone, in his jaw, as well as other tissues in his body, in addition to what I'm reporting right now. I found in his laryngeal nerve, there's a nerve that comes off the brain or brainstem that goes down into the brainstem, it goes down to your vocal cords. The vocal cords don't know how to work unless the signal from the brain is going to the vocal cord by the laryngeal nerves. I found more bacteria on his laryngeal nerve, specifically strep infection. I found his parathyroid gland infected with candida and the same strep that I found inside his hypothalamus, which is same infections that I found inside his jaw and his gums when I did that dental exam with him. Listen, the point here is, and I'm going to wrap up this video right now, the point here is that when you have these crippling neurological conditions, these crippling autoimmune disease conditions, these crippling motor neuron conditions, and the doctors are only running a CT scan or running an MRI or doing a reflex test with you or doing a strength test with you or doing a nerve conduction test with you, or they're checking your blood for red blood cells, white blood cells, or looking for a virus or looking for Lyme disease or looking for whatever, unless these doctors can actually find where these infections and toxins are that are in your tissues. It's not just a hair analysis to look for metals in the hair, or a urinalysis to look for metals in the urine, or a cytomegalovirus, or an Epstein-Barr virus, or a Lyme blood test. You've got to understand these infections and toxins can be in various amounts and in various tissues at the same time. And certain tissues are going to have more infections than others. We've got to have a very precise, exact scientific method, which I practice every day in my clinic, method to be able to find these infections and rid them from the body without harmful drugs that have harmful side effects, or what they call side effects, I just call an effect, and without using other kinds of herbal formulas which may actually excite or stress, inflame your nervous system, inflame your immune system. So hopefully I've shared with you some information in this video to make you more aware of what's going to cause these crippling neurological degenerative autoimmune disease conditions, these weakening conditions. His surgeries didn't help him on his hands, only made him worse. He's got chronic inflammation for more than a couple of decades, I'm certain, because of prostatitis, the heart condition, the heart surgery, the stent in the artery, the carpal tunnel surgery. It's just not good. But with enough time with me, I believe that I'm going to help him repair himself, and enough time with the dentist to clean that up, and we check and make sure that the mouth is clean of infection and toxin. It's imperative. So you can get involved. Anybody who's listening to this, who's looking to get involved in finding what's causing their their infection or toxin in their tissues. And again, this is the first protocol. He may have infections, more infections in his stem cells. He may have more infections, probably does, inside his motor neurons. He may actually have more infections and toxins in many different tissues, including his heart, including the nodes on the heart that conduct electrical signals to the heart, including his ventricles and his valves, including the aorta, including the spinal cord. I'm going to have to hunt all these down and clean them up. And I will help him do that as long as he sticks through this. But sometimes the healing is not just happening overnight where people regain strength in one protocol. It took him years. He's 66. It took him years to get into this condition, and it may take us some time. I don't know how long. I don't have a crystal ball. That's the way that it is. So hopefully points are well made here and help you really understand. Watch other videos on my YouTube channel, and actually give a thumbs up, a like to this video if I brought you some information that you didn't hear before or made it even clearer for you to understand. Let people know that you like this information. As well as subscribe to my YouTube channel. I share videos on a regular basis, and you can actually get information or get an email, get a notification when I put new videos up on my YouTube channel, so you're the first to know when I've got new, groundbreaking, excellent, unique information on my YouTube channel. Also, like me on my Facebook page. I put up unique information there all the time, and my Instagram as well. You can like or follow me on Instagram. I put information up there as well. And call my clinic at 954-370-3100, or send an email to my assistant. I'll put that information up here on the screen, whether it's below me or on the side. I'll put up her email as well as the phone number. I'll leave that up for a while here while I'm speaking, because you deserve to really start to figure out what's going on in your body, not just a test and you're doomed for the inevitable crippling disease to remain in your body, or even cost you your life and cost your family their time of being with you on this planet. What else? Further is that just unfortunately, insurance policies from any insurance company, whether it's Medicaid, Medicare, disability policies, workers' comp policies, or any kind of PPO, HMO, any of these policies from any insurance companies do not recognize the work I'm offering you. So this is an investment out of your pocket. When you call or email my clinic assistant, she's wonderful. She'll be happy to help you and set up appointments here. We've got to consult with you first and then get on the journey. And a consultation is really important because I got to dig into your history and find connections to your condition. Antibiotics can be causing conditions in you. The vaccines may be causing crippling condition in you. It's not just, I spoke to a doctor and I give the regular information. My consultation with you is going to be so different, detailed, getting into various possibilities, connections in your life, in your history, that I've got to look for in the exam and help you clear things up. I thank you for letting me come into your home or on your mobile device or on your tablet or your computer at work or home, and allowing me to share this with you. Again, call my clinic at 954-370-3100. Email my assistant. We'll be happy to help you. And further, people do come to my clinic in South Florida, where I'm located now, near the Fort Lauderdale Hollywood International Airport, which is at the southern tip of Florida near Miami. We're 30 minutes north of Miami at this time. We're about 10-15 minutes west of Fort Lauderdale Airport. People fly into my clinic daily, not the same person every day. I'm saying that people from different parts of Florida, different parts of the United States, as well as different countries. We've had people from Norway, Netherlands, Italy, from Canada, from the United Kingdom, from Thailand, flying into my clinic for this very unique work. Okay? I look forward to helping you. See you soon.